So if you've been trying to treat methane SIBO and you're not getting anywhere, then you're not alone. This can be an incredibly stuck, sticky, hard to treat digestive condition. And there's been a very big kind of paradigm shift that I've been going through in my practice when I approach methane SIBO. And I just wanted to share that with you. I see a lot of people kind of doing it backwards or doing it wrong, in my opinion. Again, there's not a one size fits all. It would be too easy if that was the case. You wouldn't be watching this, you'd be better. So it's not that simple. But again, I've found that flipping the approach and starting with different priorities is massively beneficial for the vast majority of methane SIBO patients I treat. Like I say, I treat a ton of methane SIBO, and I've got some really interesting insights that I want to share with you. So first off, what's methane SIBO? It's also called now intestinal methane overgrowth because it's not actually technically bacteria, the B in SIBO. It's more archaea, methane-producing archaea, most notably Methanobrevibacter smithii, but there are definitely other methane-producing bugs. To me, that's kind of irrelevant. When we do a SIBO breath test, we don't know what bugs are producing methane, but we do know when you are methane SIBO that you are producing too much methane. So wherever the methane's coming from, some bug's producing it in your gut, and it's causing these symptoms, most notably the most common symptoms: constipation, sluggish digestion, bloating, distension, gas. Those are all like hallmark symptoms of methane SIBO. There's a few little kind of pearls there. Someone wakes up in the morning and they are bloated and distended before they have food, like bloated and distended fasted. That's kind of telltale methane symptoms. And then also some kind of not always symptoms, but things like reflux, again, things going the wrong way, that can be a methane SIBO piece as well. There's a couple other symptoms, but that's the general picture. I can see the comments already. I've got methane SIBO, but I don't have constipation. Right there, I would track transit time, and we're going to get into that because almost every methane SIBO patient I've treated, again, there's never an always, but almost always, they might have normal bowel movements, but the time it takes for food to pass from their mouth to the toilet bowl is typically slower than optimal, slower than healthy. So let's get into it. Where are people going wrong when they're trying to treat methane SIBO? So the three mistakes that I see people make when they're trying to treat methane SIBO is, number one, they are starting with antimicrobials. And all of this makes total sense to me, right? Like, it's not a simple concept and it's not intuitive. You got a bug, the bug's causing the issues, treat the bug, issues resolve. But if you are that typical methane SIBO patient that's not seeing results with standard frontline therapies, maybe you did antibiotics, rifaximin, maybe you did metronidazole or neomycin or whatever, maybe you even felt better for like a month or 2 or 6 months. It's less common. It's a short window, a little honeymoon post antibiotics where people will feel better. They're like, great, I'm done, we'll never have to think about this again. And then zoom, their symptoms just come right back and they regress right back to square one. Often worse because with the antibiotics, you've eroded that foundation that keeps your gut balanced. That's typical, and you can even extend that over into herbal antimicrobials, whether that's oregano oil or garlic extracts, berberine, neem, a whole bunch of other ones. I like them. I use them all. I don't have a problem with them. But when you're starting with antimicrobials, trying to fix the methane piece, it's unlikely you're going to get anywhere, and often people take more or different, or they're on this long extended plan. You might be watching this and maybe you saw benefits with it and off you go, you're feeling great, good. But I'm talking about the patients that aren't getting better with that approach. The number one mistake is starting with a kill phase first. Second huge mistake that people make when they are trying to treat methane SIBO is they are not prioritizing the terrain. And there are two pieces. Number one, constipation. If you are the typical methane SIBO patient and you are constipated and you are trying to treat methane SIBO with antimicrobials, if you were a patient of mine, again, not medical advice, would advise not to do that. And I would start by treating the constipation. I would kind of forget for a month, 6 weeks, 2 months that you even have methane SIBO, and I would just work on bowel movements. We want daily, complete, satisfactory, no straining, not dry, like full evacuation of your bowels each day. And then we can go back to, other priorities, which we'll talk about. So number one priority, often neglected, is bowel movements. People think, look, treat the methane, it's causing the constipation, and the bowel movements will improve. I would switch that around, prioritize bowel movements. The third big piece, so we have started with antimicrobials. Not recommended, don't see benefit with that for most. Again, you might be the exception. Number two would be not prioritizing bowel movements and hoping and expecting the antimicrobials to improve bowel movements. Focus on that as a standalone symptom. Get your bowels moving. How much better do you feel? We'll get to that in a second. And then the third big piece is motility. And so, sometimes, not commonly, but sometimes methane SIBO patients will come to me and they're like, I'm having perfect bowel movements. My bowel movements and my motility are fine. Maybe they don't quite understand what motility is, and maybe they're gauging that based on the frequency of their bowel movements. They say, I have a bowel movement every day. My motility is 24 hours. Do not make that mistake. Major, major, major mistake. I would track your motility mouth to toilet bowl. And the really big piece that I saw, this was years ago, but it's like baked into my brain, was a patient who was dealing with chronic urgent, not methane, but it illustrates this point I want to make, chronic urgent loose watery bowel movement 6 times a day. We skipped transit time. So look, let's not test that. Didn't get better, nothing improved. And then eventually we're like, look, just track the transit time, drink some sesame seeds in water, swig it back, don't chew them, look for them in the bowel movements, and tell me when they first turned up and tell me when they obviously stopped turning up, the general kind of ballpark. And he finally did it. It took him 7 days, 6 bowel movements a day, urgent, watery, loose, 7 days for him to pass from mouth to toilet bowl. So no wonder, and this is very typical with methane SIBO, although they're not constipated, no wonder there's bloating, gas, distension, abdominal pain, that trapped gas, sharp, stabbing, discomfort with food. There's a lot going in and there's not a lot coming out. There's this real backlog with slow motility. And if you think about the kind of pathophysiology of methane, when it's impacting your gut negatively, it slows down that sweeping kind of smooth muscle contraction that, moves things down and out. So the slower that's going, the more it's going to favor methane. The more the methane grows, the more it's going to slow things down, and you just wind up digging yourself deeper into that dysfunction. And so prioritizing motility is huge. Track it, get really, really comfortable with that. Beyond successful methane SIBO treatment, I say this is your kind of gold standard motility. And if anything happens along your kind of journey in your life and things slow down, that's the first thing you want to jump on so that you don't fully regress back to square one and then have to run the kind of full protocol to get you better again. The more you can prioritize motility, this goes for gut health in general, but definitely methane SIBO, the more you can prioritize motility and moving things through at an adequate speed, the healthier your gut's gonna be. So I hope you're getting something out of this. If you're looking for support with methane SIBO, then you can book in the link below. Let's get back into it. So those are the 3 big mistakes, starting with antimicrobials first, not prioritizing constipation, and then once bowels are moving, not prioritizing motility. I work them constipation first, then motility, and some often we'll do them both at the same time. I'll link to a little case study at the end of the video. And then when we get to better bowel movements and better motility, the big question is, how do you feel? And often, again, not every time, it's about 70 or 80% of patients feel significantly better, 70, 80, 90% better than their baseline. Bloating's down, bowel movements are better, obviously, abdominal pain's better, reflux is kind of cured. And so we say, great, all right, let's just keep working on this. And this process of moving things through your gut is going to reduce that methane predisposition because the terrain is not favoring the methane. And then again, you just wind up digging into that. More methane, slower terrain, more methane. If we wind up with better bowel movements and better motility, and you are that less common, although still, common enough, it's about 20 to 30% of patients where you're still winding up with bloating and gas, still winding up with food reactions, and you are having good bowel movements and good motility, that's when I would layer in the antimicrobials. You might just say, look, why didn't we just start there? We got here in the end because paradigm flip time, the terrain is no longer favoring that methane bug. And so your antimicrobials are going to be so much more effective. Hot take time. I'm happy to be controversial because I've been doing this long enough and I've been seeing boots on the ground. I'm not stuck in the literature. I only care about what gets people better. Is it safe? Is it effective? And if we can make it affordable, perfect. That's a trifecta. Hot take, you will never get to zero methane. And I think setting people up, it's a lot like thyroid antibodies. They're trying to get their thyroid antibodies, with autoimmune thyroiditis to zero. It ain't gonna happen, right? Or it's highly unlikely. Same with methane SIBO. The big question is, how is your gut responding to that methane gas? And if we can create this kind of terrain and this tolerance, and we can lower that gas to tolerance levels, no problem. And the really big kind of justification for that, because it's important to justify it, otherwise it's just a bunch of hot air, is a bunch of us are methane producers. It depends on the study, but it's between 30 and 50% of the human population produce methane, and we're not all dealing with methane SIBO and the constipation and the bloating and the sluggish gut. And so if you can work on that terrain piece and you feel better, great, keep doing you, and that will work towards not favoring methane, and you're just smooth sailing. They're the smooth sailors. They happen in a decent chunk with this approach. And then if you don't, layer in the antimicrobials and look for them to work so much better. The last piece, and I know this is a lot of info, I'm just kind of dumping it on you. Hopefully it's digestible. Hopefully it's helpful. The last piece is the maintenance plan. I'm doing a little video now on top mistakes people make when they're trying to treat their gut. And the maintenance plan piece is often overlooked just globally. If we're sticking on methane SIBO, once we've got you better, I'm aiming for 85, 90, 95% better. What I like to do is pull people off of active treatment where we're hammering and pushing and looking for results. And we just keep that pressure on the system. Prokinetic herbs, fibers, probiotics, prebiotics, postbiotics, enzymes, whatever you need to keep your gut moving in the right direction. And then just kind of educating those patients that have been through that journey with methane SIBO, that constipation and motility, anything that slows people down is going to predispose you for that kind of relapse. And if that happens, we want to be a little bit more direct at kind of heading that off and keeping you from regressing back to square one. So I'll give you a real case example. I was working with a patient a year or two ago, and she was presenting with all the typical methane SIBO symptoms: bloated, constipated, abdominal pain, just the whole kind of hallmark presentation. and she'd done all the kind of antimicrobials and wasn't really seeing results. So we started with bowel movements, got things moving, then we worked on the motility piece. She felt so much better with that approach, and so we basically just maintained that with the maintenance plan. And I haven't heard from her for a year or two now, so I assume she's still doing well. If you want to know about that case study and all the herbs we're using, you can check that out here.